Hey everyone, welcome to Mullers on the Move. We are a traveling family of five here to help you turn your dreams into reality. Today we have a special guest. We have Adam Guzman, who is our health insurance agent, and he truly has helped us make it possible to get on the road and stay covered because, as y'all know, we have had many incidences, the concussion that happened a few months ago, and thankful for Adam, he had given us options and then helped us choose the right plan to make sure no matter where we were in the United States, we were covered. So, Adam, welcome to the podcast. Thanks for being here.
No, I do really appreciate you guys having me on. It's good. You guys have been a great clients and love helping you guys.
We are so thankful for you, especially in my frantic mom mode when, everything I know goes out the window and I'm texting you at random cities all over the US.
Yeah, that's okay. That's what we're here for. So,
Can you give us a little bit of a background on how you got started in this? And then we will dive into people's options because we could just get on a pedestal as from a provider's point of view with healthcare to being the client to benefits and all the things that the
sure.
controversy of healthcare insurance.
We get the
Oh,
question a lot on all these travel anesthesia locum platforms that, what do I do about health insurance? And, because they're used to just having their group plan on their big anesthesia group. So where do I even start to find a health insurance for my family that could go nationwide and that's affordable? And
sure.
luckily, I
Yeah.
mean, for us, we're even as a family plan, a family of five, that your policy is even cheaper than ours was when I was on a full-time big anesthesia group policy back home. So that is
hmm
most people's biggest question is obviously the best insurance that's not a scam and it's affordable for the family and how
hmm
to go about
Sure.
doing it.
Yeah. No, those are great questions. Just ironically, actually, enrolled in anesthesiologist a couple days ago. So, but as far as the
Nice.
medical field altogether, is that when I got into this, I used to be in oil and gas, and I always had really good employer benefits, and a lot of people, that's usually what they know is employer benefits,
Mm-hmm.
um, as opposed to an individual being self-employed or 1099, what it may be. But in 2020, I got wrapped up in COVID and all the layoffs, and then oil and gas kind of tanked, and my number was up, and so I got let go, and I decided to do something else, and so I got into health insurance, and again, I knew nothing about it because also too at that point I was relatively, or still am relatively healthy and didn't use it very much. But I got into it as uh, you know for myself, being self-employed and just trying something new because I was always up to that. So once I got into it, started learning all the different kinds of insurance. But that's right when I learned what Cobra was, because for myself it was costing me a hundred and say I think it was like $150 a month. But then I got my Cobra letter in the mail, and they said, "Sure, you can still have this, but now your payment's going to be $600 a month."
Yeah.
And I had just lost my job at that point, and I had a couple months where I was trying to figure out what I was going to do, and I was like, "This is crazy. How much this cost?" I had no idea. And so fast forward, I get into health insurance and I start learning about it. And then all the different types of insurance there are, which we'll talk about that in a minute. But as far as healthcare specifically, my girl's mom, she has been in the healthcare industry. She's an ICU nurse. She's a director of a surgery center now. So I've been around healthcare for a really long time. I know how it works. But then randomly, too, I had a neighbor back in 2020, because remember COVID. She was a travel nurse for Crucial and was working in New York at the time, coming back and
Oh,
forth. And
bless
and
her.
she, yes, I heard all kinds of stories about that and really learned about the travel medical, whether it be anesthesiologist, surgical tech, whatever it may be. But she kind of opened my eyes to you guys' profession needing help in this specific area with insurance. But again, I can understand why people are confused, and especially younger single nurses, or whatever the medical profession may be, on an employer plan, because it's relatively inexpensive because you're being sponsored by the staff job by the employer. Well, then they go out to travel and look at options. Then all of a
The cover.
sudden, the private insurance is extremely expensive. So then they go to the agency. I've seen agencies being $60 a week up to, I had a client with Springboard she's 26 years old, but it was going to be $1,000 a month for her by herself
For her by
and
herself.
through the agency. So the whole thing is obviously options. And the biggest thing for you guys I've learned is liking to take time off. And there's just so much fine print in these contracts that they can lose coverage in this and that. So that's what really got me interested in helping uh, the travel medical field. It's kind of how I got
Well,
into it, but
and
also to learning about health insurance.
from being a nurse and now a nurse practitioner, we honestly, I think I can speak for most nurses, don't learn anything about healthcare insurance until you get into the job. And then it's pretty much just like, do they have it? Do we accept it? As a provider, yes, we coded diagnosis to get paid. But as a mom, and I was a full time NP, I had health benefits through my hospital. However, we had to see an ENT who operated at the hospital. We didn't have an ENT employed through the hospital. So our benefits did not cover that ENT because she was not employed by the hospital, but she operated there, but she wasn't in our network. So it
Mm-hmm.
is so confusing, even as the provider who works for the hospital who's covered, to figure out what the hell is even covered.
That is a good point that you bring up, because a lot of people don't, most everybody don't realize that just because a doctor or whatever is in the hospital facility working there does not mean that they're in network with that facility.
Uh-uh.
So when I help a client, I say, who are your doctors? Obviously, let's look at networks, but also to look at, I double check both.
Mm-hmm.
Another part of being in the healthcare, having say a staff job, employee benefits, is I had a client that they went to, actually, I think they went to Colorado. And this is before she was on why she went with private coverage, and her son was skiing. I think he broke his leg or ankle or something like that. But the gist of it is they were out of network because now they're out of the facility network. And so her out of pocket cost was massive.
Insane.
And people don't realize that. The everything starts with the network, and there are many moving parts to health insurance. And to me, it's the plan has to be affordable, but two, there's a big picture of everything. I make a little diagram when I do screen shares with people, or I made a little deal that has a road with a bunch of cars on it. Starting with you have network, you have your benefits, you have what are your max out of pockets, and so on. If everything starts in network, so if you're not in network, everything's derailed off of that, and people don't realize how important the network is. And but really, it comes down to people's medical needs, because before Obamacare was developed, the best thing about Obamacare is, which would be the marketplace or ACA.
Mm-hmm.
A lot of people don't know that employee benefits are actually ACA plans. They're ACA regulated, meaning that there's maternity on the plans, there's drug and alcohol counseling, there's mental counseling. The biggest thing with those plans, though, is that there's no pre-ex clauses as far as pre-existing conditions. So even if somebody has cancer, they can get on the plan, which is great. But outside of an employer plan, if you're looking at the marketplace, the flip side to that is the cons are going to be smaller networks, higher deductibles, higher premiums. And I think I tried to explain to people the easiest way to understand insurance. And really, it's all insurance. It's a risk management business for that company. How much risk are we going to take on somebody or on an individual with their needs? So when you have these plans on the marketplace, and when we use a traveler coming from employer benefits and looking for a plan outside of that, is that if you have somebody with these medical needs, there has to be something to offset that, because not everybody has these types of needs. And that's where the two categories of plans came in. You have the guaranteed issue, which would be the no pre-ex clause, employer benefits. Same thing with the marketplace. The other side of that is there's underwritten products or plans that are somewhat based off of health with underwriting guidelines to get approved. The purpose of that is it's a lower risk pool of client, but if
Mm-hmm.
you can fit within this lower risk pool, then you're able to have increased benefits and lower premiums because you're a lower risk. But if something happens to you, yes, the benefits are there, and then it opens up a national network to where you're covered across the country. So
Right.
I know sounds very confusing, but really it comes down to two things: is what is your medical needs and your benefits or your affordability? Because if you can think of a horizontal line, right, Above that line, your true measured medical plans are only going to be employer benefits, the marketplace, or the underwritten private plans that say we offer. All the other plans below that, which would be short-term plans, fixed indemnity plans. Fixed indemnity means they're only going to pay what they say they're going to pay. So let's say you have an MRI and they're going to pay $300. Well, that MRI may cost $2,000 or whatever it may be. You
that ain't
owe.
gonna cover anything.
No, I know, but those plans that are specifically, and there's a carrier that offers these plans, there's no max out of pocket. So I have a client here in Oklahoma City that a year and a half ago, she was on one of those plans, but she wasn't told that there's no max out of pocket. And I explained this to her. So she gets off the plan. And then and she's healthy, nothing going on with her, gets on one of our major medical plans. 5 months later, has diagnosed with breast cancer, just out of the blue. So without me explaining that to her, she potentially could have gone. She's self-employed real estate agent, medically
Yeah.
bankrupt. I have all of her hundreds of thousands of dollars in claims. So that's where it kind of also comes down to, I would say, uh, you guys had asked, what should a traveler do once they're out looking? The most important thing is, don't go on the internet and start Googling stuff, because one, as soon as you put your information in there, you're going to get called by
600
1,000
phone
agents.
calls. Yeah.
I have a
Yeah.
client 2 years later to this day, she's still getting calls from people. It's sad, but that's what happens. But
Yeah.
the biggest advice on that is talk to a trusted coworker or something that, you know, knows somebody and get a couple of opinions. But at the same time, you've got to remember back in your head that everybody's situation is different. So these plans that are not true insurance plans that we're talking about, like say a health share plan, they may say, I have this plan and it's great. It does great for me. There's some questions in people's head that they should know to ask. Well, how much do you use it? Which people that are not in the insurance world, they don't think of things like that. But I've almost wanted to post, and I may do this, post just 3 simple questions. If you're the person looking for insurance, you should know to
Mhm.
ask your agent this. Uh, is there a max out of pocket? What is the specific network? You know, there's these certain questions that you can ask them to make sure you're getting a true insurance plan, and hopefully not being just sold something. And that's the thing, is that
Yeah.
when you have a client, or working with a client, the patient, you should be working with that patient to pick out a plan together. The agent should not be picking the plan for them. And we see it all the time, and it's unfortunate, but that is what makes my job hard. Like I've said before, I'm very
Yeah.
blunt about it, is that there's 2 types of people, agents. There's an unethical one trying to make money, and then there's one that's trying to be an advocate for the client and help them out. And that's what we do in our office with that. But unfortunately, that's any profession in the world. But insurance is really bad. It can really, really affect somebody.
Can I ask, do y'all get paid off of commission or sales, or like a percentage of the
We do get paid
plan?
off. I'm commission based completely, but outside of that, we don't. Again, because I don't know, we can't help everybody.
Mm-hmm.
I do work with some other I have a partner that with me, she helps me with she does the ACA plans for me. We don't work with any of the short-term plans, health shares, things like that. We only focus on major medical coverage,
Mm-hmm.
because at the end of the day, that's what we need to protect the client at the end of the day. So,
Well, and I ask because it does, I mean, the world that we live in, people are just trying to make a buck sometimes. And then if they're working
yep.
off commission, they'll sell you anything.
Well, and that's the
Mhm.
thing about plans, and I'll put that list together and I'll send it to you of questions to ask, because
Yeah.
let's talk about that client of mine that had cancer. So when you talk to somebody, and that's what happened to her, is with that plan, it I do screen shares with my clients. I know I did it with y'all, where
Mm-hmm.
you can see my computer screen. I show you the plans. I think
Yep.
that's the most transparent way to do things. But if you get on the phone with somebody, as she did, and they say, "Oh, I've got this great plan. It's a PPO. It's nationwide." Okay, that's great. PPO just means you can use whatever doctor you want. Whereas if you have an HMO, you have to have referrals, and it's a very, very cumbersome plan to use. HMOs also don't have out of network coverage. But as far as the PPO, what are my exact benefits? And I will say there's a word to be very, very wary about is when people say, this is covered, this is covered. And you hear that all the time with agents. Oh, you said this was covered. I never use that. And I train agents in the office that I tell them you're paying for benefits to benefit you. That's literally what these
Yeah.
words mean. And when somebody says this is covered, they're not they're potentially not giving you the whole story. I think people get the misrepresentations. If you have insurance, then everything should be free, and it's
Right.
not like that. Some people, maybe not realizing they always go for unless you're highly subsidized by the government. And a lot of people don't know that if you're offered employee benefits, you can't be subsidized by the government through a marketplace plan. But unless we'll take the very low income situation because there is places for that, and we help people with that. But think of a seesaw on a playground. We're older; the younger kids may not even know what that is. But if you're sitting on a seesaw on a playground and it's level, and you put two kids on there, and one side goes down, and the other side goes up, that's the same thing in insurance. The least expensive, as the cost goes down, your out of pocket cost is going to come from somewhere. It's a numbers game.
Mhm.
And so, again, that's where the private underwritten plans, we try to help level that playing field of lowering costs, lowering out of pocket costs. But some people, they can't. Uh, they'll have to go on the marketplace. I have a client that she has to be on the marketplace. She takes Skyrizi. I'm sure you've heard that medication. That's $22,000 a month. So that's another thing with medications is there are loopholes with medications. It's finding an agent that will help you find that loophole. There's coupons through manufacturers. There's companies that will agencies that will get you the medications. They can be somewhat income based, but there are loopholes to things, and that's the one thing is finding an agent that will help you with everything, medications, and that's what we do in our office and really strive to do.
Well, and before we started working with you, we did use Marketplace because as an NP, I went part time and I lost our benefits. The hospital only provided benefits, healthcare
Hmm.
coverage for full time employees. And
Hmm.
Blake's company, I mean, which you would think you would get some kind of benefit if you work in healthcare, but you did not.
Yep. Yeah.
So we go to the marketplace, and my agent had said you can add on maternity when you need it. Okay, well, to me that means like if I get pregnant, I can add on maternity coverage.
Oh yeah, this is
It
Hmm.
did not. He meant when the period opens, whatever date. Well, I mean, I didn't plan my pregnancies back then, so
Sure.
we couldn't get maternity coverage with our
Oh
last
gosh.
kid, and he wound up being a NICU child.
we had a
Oh
lot of
wow.
out of pocket expenses
Yeah,
for NICU, neonatologist, the whole birth pretty much
yeah.
at the
Uh-huh.
hospital that
That he
I
worked at.
yeah.
He was chief of anesthesia
Oh
at,
wow.
and we
Wow.
had freaking marketplace coverage with no maternity because
Be
I
kind. Be kind.
misunderstood. My fault. Misunderstood what the agent said when he's or marketplace employee, whatever they were.
That's why we
You
need
can
to
add
get
on
Adam
maternity.
Guzman.
Yeah. Well, and that's what the marketplace is just very, very
Yep.
hard to use because especially
Yes.
when you're running your income off it with being self-employed, because if your income changes or you'll run across an agent, because this happened to somebody close to me that I know, they were adamant on, well, my buddy's taking care of me, I'm good. I'm like, okay. Last year he told no 2 years ago he told him, well, just show this income so you'll pay less a month, and you may have a little you may have to pay a little bit back at the end of the year when you do taxes. Well, then he got hit from the IRS. He owed $8,000 back at the end of the year. And that's the last thing you want to happen. And
Yeah.
on top of that, when I was talking about premium, everybody is, I don't want to say everybody, but most people are so fixated again on that upfront cost. I want it as cheap
Yep.
as I can at the
Mhm.
beginning. So when they go on the marketplace, you have bronze, silver, gold plans. Well, just put me on a bronze plan because it's $200 a month. I don't
Mm-hmm.
need the other plan, but they don't realize that they have a $8,000 deductible, and every time they go, they're paying out of pocket. Then they're
Yep.
asking, "Why is this happening?" Well, it's because of the plan you chose. So that's really where being an agent and explaining all this, and I have helped people and explained it, and I've been fortunate enough because yes, it's a sales job, and I help people, but also too, I have a lot of clients that have opted to pay more because they understand how it works. And at the end of the day, it has saved them when something has happened. And that's really what's frustrating with the relatively healthy people. And I get that 100%. People also that are healthy, they feel like they're invincible and nothing's going to happen to
Yeah.
them. I have to remind them when they go into a hospital or clinic, there's two codes. You're either coded sick, and I ask them the question, or what? And they just kind of sit there, or hurt. You're either sick or hurt. And I can't help, if you get T-boned at the intersection or you're skiing in Colorado,
Yep.
or whatever
Yeah.
happens. Myself, I'm 44 and still kind of a dummy, but about 4 years ago, I jumped out of the back of my truck and broke my foot in 3 places. Stuff happens.
Yes.
So that's
It
a
is.
big thing. And
Yeah, it is unfortunate how expensive everything is, and as healthcare providers, both of us, we work in hospitals, so we know how expensive everything is. Just surgeries are tens of, even hundreds of thousands of dollars. So I've always just said for years that I don't know how health insurance isn't way more expensive than it is. I guarantee if it was much more, not many people could afford.
Yeah.
Nobody could afford health insurance, but we had just MRIs, the CTs from our kid who had the concussion from falling off a bike, and the total cost of that's $25,000. But
Yeah, we
to
got
make
a bill
sure,
for 25 grand and I was like, they hadn't run the insurance yet, but they literally
sure,
sent me a letter that said, you owe, here's what you owe.
yeah,
And I was like,
that's if we're insured, and through you, it was covered most all of it.
yeah.
But
yeah,
since, like I said, 90% of people just focus on cost, one of the cheapest things you hear out there are these Christian Medishare
hmm
plans, even for families that may cost, $400 a month. What are your thoughts on that? And you
So
know,
I have pretty strong feelings on those because, as just obviously being an advocate for the client and being as transparent as possible, we have experience in the office with somebody that was on one of those plans. But really, at the end of the day, you'll get, depending on which plan, there's multiple Meta Share, Christian Health Share. There's different. All you need to know is if they are all health share plans, they all work the same. Most of them, all of them, do not cover any pre-existing conditions. I was helping a client one time. She was frustrated with it because I think her little boy was 6 at the time, and he had asthma. A lot of kids have asthma when they're younger. I
Yeah.
had asthma. Don't have it now, but as a kid, they wouldn't pay for his albuterol because they said it's a pre-existing condition for him. So the gist of it is, whether it worked for somebody or not, all you have to do is go to the website, scroll all the way to the bottom, and at the very bottom, it's on every one of them. It says, "This is not insurance. This is not regulated by the government." And their exact words are, "We are not liable to pay medical bills." It specifically says that. So you as a person, not you, I'm saying in general, but in general, is that something you would want to hope they pay something if something
Right.
happens to you and you go into the hospital? It just doesn't make sense to me. But
so
at
you
the
would
end of the
consider it
day,
rolling the dice in a gamble, essentially,
100%,
when it could be
100%, because
hundreds of thousands of
When
dollars.
I guess it depends, like any plan is what is your out of pocket cost and what does it actually cover?
Yeah,
Which we
yes,
looked into it years ago and we just didn't know enough about it
you
to,
assume it's 100% out of pocket
yeah.
till you meet this giant
sir. And I get a question a lot.
yearly
The clients will
deductible.
say, "What if I go to the ER?" And I say, I get that, but my hypothetical of the ER is hard to say because I've seen $1,000 ER visit. I also had a client that is a travel nurse in Florida. She went and stayed overnight, and that one claim was 90 grand.
Yeah.
So it just depends. So what I tell them, I say, look, after all these benefits, this is what you need to know that's important, is that worst case scenario, after all the contracted rates and benefits apply, if you go to the ER, whatever it may be, your worst case scenario is your max out of pocket of X. This is what you need to know. This is the most you would ever pay on this.
Yeah.
But there's also too, when you're talking about, say, these fixed indemnity plans, and you ask that question on one of those plans, and they say there is no max out of pocket. That's where it's understanding, what the different types of plans are and the key words that you hear. Oh, well, this is a fixed indemnity plan. I don't want that. That's not a true insurance plan. So,
Right.
um,
It's kind of how I think about it. Like, here's what we pay X amount a month. Here's what our max out of pocket is. I'm like, if the worst case scenario happens, we are going to owe 20,000 for the year or whatever,
Yep.
15. I can't
Yep.
remember what all our stuff is. However, if we're not covered and something, we would have already paid 25,000 just for one incident last year.
Last year, we had a client in January in Oklahoma. He got in a motorcycle accident, very bad accident. I know he's alive. I think he's fine now, but he had multiple surgeries, and his claims were upwards of, I think, $865,000 or something like that from all these different surgeries. So, again, you guys are in the medical, you see these, but we see
Yeah.
these claims, and it's hard for people. When I see them go on Facebook, I saw something the other day of somebody here local posted, insurance is a scam, and insurance companies making all this money. But it's funny to me because with all these claims, you're paying the insurance company. The insurance company's paying all of these claims. Like they're not,
Yeah.
they're not necessarily making a lot. You may pay them $7,000, but then they're turning around and owing Integris,
700.
$100,000
Yeah.
for the difference. And so
Yeah.
it's the biggest, and I think the worst thing that's happened the last year is the CEO of United Healthcare being murdered. At the end of the day, this gentleman was murdered. That's a whole thing, right? But you saw what happened in kind of bad stuff that's happened. They're saying that, with insurance companies and United Healthcare doesn't pay claims. It's social media is the worst. We know that. People don't know that companies have subsidiaries and they may have gotten sold something that, yes, their United Healthcare has a short-term plan called Golden Rule that it is a short-term plan. It's called that for a reason. It's a very limited benefit plan, and it creates more out-of-pocket cost. Or they may not know that they got a plan. They wanted a cheap plan through United Healthcare that has a $9,000 deductible, so that's why their $2,000 claim didn't get paid. There's reasons for this stuff happening, and I get it, but at the end of the day, it's kind of frustrating. I see on Facebook all the time people, well, my roof didn't get paid. My car insurance, I got direct with somebody. That other person didn't have insurance, so my insurance has to pay. And now my insurance is going to go up right now when I make that one claim. That doesn't happen in health insurance, and they're okay with that, but
Right.
not when their $100 doctor visit didn't get paid for.
Well,
So,
and people, I think in this day and age, they want the answer. They want an answer, and they don't want to do any of their own research. They want the cheapest option, the fastest result, without any work on their
that's
end
it.
put in. And so
That's it.
when you have somebody try to sell you something for cheap, oh, that sounds great. I'm going to do that. And
Yep.
also, I mean, not to crap on healthcare workers, but don't look at me like that. You wondering where I'm going? When our kid had tubes put in,
Yep.
we got the bill, and it was kind of an outrageous amount for our kid to be back in the OR for 5 minutes.
Yep.
And I luckily looked at the bill, and I said, how many bottles of eardrops do you open when you do a case on tubes? And he said 1, which I figured because they put a couple drops in there, and then they hand the mom we were charged for 2. Not a big deal, except they were $750 for a little tube of eardrops. Well, you just charged me and I haven't met my deductible. So now I have to pay an extra. So luckily we were able to, go back.
But in the hospital that you work at,
I think somebody had
$1,500 for
eardrops.
Essentially one bottle.
Yeah, but somebody had charted it. Or
there should be more than No Surprise Act out there. There should, in my opinion, people should have some generalization
of what you're about to get hit with. Yeah, which is a whole other issue.
Now they are supposed to, if you ask, they're legally supposed to tell you how much it's going to cost. That did change. It used to not be like that. But it's also with claims, people will take surgeries. For example, I was helping somebody with a hernia surgery, actually in Florida too. If he had it done at this certain hernia facility, that's what they do, then you're just getting charged what the doctor and anesthesia is doing. But if you're obese or have a stent or something else going on, they have to send you over here to another facility. Now what happens? Now you have the $2,400 facility charge that they just tack on there.
And all the other stuff too.
Well, and the one thing that's crazy is when you look at claims and you see it from a hospital and it says miscellaneous, and there's just a number. So if you ask them, they have to give you a broken down itemized list of what all this stuff is.
Mhm.
And a lot of times too, I tell my clients that one with me, obviously you guys know, call me, don't call customer service. That's the worst thing you can do. But with these claims, there's so many mistakes being made in medical billing that gets caught, and it could
Yes.
be
Yes.
something coded wrong.
Nobody blames you
Yeah.
in insurance, but doesn't blame the hospital.
Or
medical
the
billing.
nurses who just started, oh, this is dirty. Let me get you another one. Well, everything
Yeah.
you get has a barcode, and there was maybe something not wrong with that thing, and now they just charged you, and they just scanning it like they got nothing to do. And guess
Well,
who gets charged? The patient. It's
yeah.
so
Well,
annoying.
in the last year, I think one of my best other helping a client is that she called me. She wasn't necessarily blaming on me, but she was frustrated because she went into the ER and this and that, which people also have to realize the ER is the most expensive place on earth because you don't know what they're going to do more
Anything
than
and everything.
anything needs to. And every time that doctor or another doctor comes in, you're getting charged. You're getting coded for
Yep.
this. But she went in and I called the facility. This long story short is they had coded it sickness when they should have coded it accident, which totally changed the claim cost wise for her and essentially almost wiped it all out. But it was all because it was coded wrong. And that's all it was. It was a matter of just changing a few numbers. And she
We
was
had
very
somebody
grateful.
call us
But
about our kid's concussion, and they said it looks like somebody put motorcycle accident. So you might want to claim this on your car insurance. I said, she is 6 and it
yeah,
was a bicycle. So, like,
yeah,
y'all got to go fix whatever note or code or whatever y'all
yes,
put in
yeah,
for a
yeah. Coding,
motorcycle.
it all comes down to coding. So I guess with my advice on that, just like you guys are saying, though, is look at your claims and really, if something doesn't look right, hopefully you have a trusted agent that you can call and just talk to them about it. And a lot of stuff can get figured out, uh, or wiped off, like you were
Yeah.
saying with the Visine, or not Visine, but
The eardrops, like,
the
so ridiculous.
eardrops.
Yeah. Call
They
the
can
billing
change
department
stuff.
at a clinic or a hospital because they will, I find, if you bring it to their attention.
Yes.
Because they don't have time to check every single item for every single patient. Now, if you're at a smaller clinic and they really need that money, they are going to
Mhm.
make sure to go back to the provider and add on anything and everything to get paid. But if you're at a large institution, honestly, don't have time to read through every single itemized receipt.
No. Yeah. But just lean on your agent. Obviously find a trusted agent. Uh, but with the healthcare workers, and really it goes with anybody, uh, looking, because I get a lot of clients too that are with employee benefits and they're like, hey, I'm going to go self-employed. We need to get our own insurance or whatever it may be. With marketplace too, you have to realize that really comes down to zip codes, where you live. You guys are from Louisiana. Some
Mm-hmm.
plans have out of state benefits, some don't. That's another question for your agent. Do I have out of network benefits? If I have to be on this marketplace plan because of my medical needs, let's talk about all the plans. I may need to get a little better plan on the marketplace, uh, for that. So it 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 is very, very confusing, but I go
Yes.
into every conversation knowing this is confusing for them. So let's quickly educate, but I also try to make it as easy as possible, uh, to kind of not dumb things down, but just make it as easy as possible so they understand. At the end of the day, the client's got to be comfortable what's going on and really understand what's going on with it.
Well, and we have I say a lot, we have a good bit of friends, family who are miserable at their jobs and won't leave because benefits, in theory, and maybe,
Can't retire. But
yeah, maybe I'm just cynical, morbid. I don't know. I'm like, I ain't sticking around in a job I hate to maybe get in a
No,
car accident tomorrow and not make it. So we did
that's a
not let
good
that be a
point.
barrier
Yeah,
for
no, but
us.
that's a good
But
point. And again, I
there's
working
options.
with every situation is there are options. A lot of times the employer benefits are more expensive than what you could get on the private network because they, or I say private outside of employer benefits, is because obviously
You don't pay
the
for things.
employer
Yeah.
the employer helps the client or the employee paying for part of it. But once you
Mhm.
start tacking on spouse and dependents, my girl's mom sent me a referral here for hospital with her by herself there. It was like $80 a month, but to add her husband on was $800 a month at the hospital. She's like, I'm not doing that. And
So
so
what did you like? Yeah.
there are other options, and I get it, but if they're stuck at a job, first of all, don't let that, because that's just making you not a happy person and you probably need to
Right.
leave. So
Like
just know that
you
they're
can't pay me enough to stay at a job that
the only time the
I don't
employer
like.
benefits, I will say that I've told people, or if they leave, I say, I know Cobra's this much, but this will be a better option. Is a lot of it can be medications. Employer benefits, they're not always great, even in the medical field. I've seen some staff jobs that the benefits are not good.
Mm.
And but it's sometimes there are small instances that yes, they need to stay on that employer job because their medical needs are so great that unfortunately
Yes.
that does happen. But if they just don't like their job, there's benefits out there. They just
Yes.
need to explore and get with somebody, and
Yeah.
don't
For sure.
let the benefits keep you there. For sure.
So Adam,
Or we can split people up too. Sorry.
yeah, that's true. As more of a
Mhm.
formal introduction, so Adam, because we have insurance through you through United
Yes.
Healthcare, and
Yes.
so
Yes.
are you working for United Healthcare, or you're just your own company who then
So that's a
contracts
good
to them, or
yeah, that's a good question. So there are actually two types of health insurance agents. You have a broker, or you have a captive agent. So with myself, I'm self-employed, but I am captive. I work for United Healthcare. Yes, I know about all plans. I can talk about all plans. Uh, but with a broker only has access to marketplace plans or all the other not in true insurance plans that we had talked about. A broker does not have access to our plans. Our plans are the only private outside of the marketplace true major medical plans available, but we only have access to those. So I do have an office. I have agents that I work with, but me specifically, I am self-employed and I work for United Healthcare. But I have a partner that I work with for ACA plans, like I talked about. Depending on which route the client needs to take, which fork in the road, we can help with everything. But that's how health insurance breaks down. You either have a broker, knowing if you talking to a broker, they're not going to have access to our private plans that are available because I work for United Healthcare uh, in that sense, if that makes sense.
definitely that clears it up for sure.
Yep.
Do you have
Yep.
any other questions?
No, this is great in my opinion. This is I even learned a lot here.
Yeah. I
I
mean,
like
there's
podcasts. You actually get real conversation with people that that a
And
lot.
he finally believes me that our health insurance is good. So thank you, Adam.
Well, I've always
Just
believed
kidding.
it.
yeah,
I know, poor
I
Adam.
hope
We call
so.
him like once a year. We're like, so should we do PPO? Should we add dental? Should we change? And we're like, why do we keep trying to fix the
And he
No,
wheel?
still
The
has a
wheel is
smile on his face and leave him do a podcast with us. So we have a good
no.
agent here.
I just love it. That's one of my things. I love helping people, and it's people ask me, do I like what I do, and it's kind of sounds kind of silly, but I can make a living off of helping people, and that's truly what we do here. Because again, we're not here to just sell something to somebody. We're here to help. But I especially my travelers, I'll text them. I have one one traveler. She's younger and all the time, but it's fine. But I say I'll get a text from her. Hey, Adam, I'm in North Carolina. I'm at this zip code. I need a. She just did the other day. I need a PCP so I can go get a physical. Can you send me a list of in the network? Yeah, it's fine. Yeah, you can do it in your portal. Just call me. It's faster. Just send me a
the
text.
portal
I'm
is
always here to
not
help.
very usually user friendly. I have to
It's not.
say, like
It's
that portal, that is the worst part. Is the portal. So yes,
that's fair enough.
I
Yeah,
do appreciate when I text you and you're like, what zip code are you in? I'll pull it for you. Yeah, that's always the question. What zip code? Yeah, the
yeah.
portal's
So
not, that's my only complaint is the portal.
at the end of the day, if you get a trusted agent and one that works for you, not the that's another thing. I was listening to a podcast about insurance and sales and this and that. That's one thing I liked that they said is we work for the client. We don't work for the agency, whether it's my company or not. That you're working for the client. If you're working for the agency, that's just somebody trying to sell you something, and that's what you
Yeah.
don't want at the end of the day. So we're always here to help answer questions, especially me with you guys. Any of my
Yeah.
clients, my phone is always on, all the time.
Well, and we're a little biased, so we appreciate you.
Thank you, Adam.
So much. I mean, Blake
Yeah.
brought we did add the dental insurance. We wound up adding that. And Blake brought the littlest one the other day and he had to get x-rays. And he's like, we didn't have to pay anything.
Yeah.
Okay.
No, nice.
Well,
Yeah,
thanks a lot,
no,
Adam. We'll have all your information in our footnotes and our email
yeah,
that we send out and all, and on the social media. So thanks a
I do
lot.
really
You
appreciate
get some
y'all's
people
time and
refer
allowing
to.
me to do this, come on and help you guys. And hopefully I can help some of your friends and family or coworkers, whatever it may
Absolutely.
be, because it really means a lot to us to help. And we really do get it here of your profession and how it works and what's needed. So, but thank y'all for y'all's time. I really appreciate it.
We
So,
appreciate you. I will link all of Adam's information in our show notes. And if you're not already subscribed to our email, go ahead and sign up for that because it'll go out in there as well. And you can check us out on YouTube, Spotify, and Apple Podcasts.
all
Thanks,
right. Thank
Adam.
y'all. You guys have a good
Adam.
weekend. All right.
We
Bye bye.
appreciate you. Bye.
Uh huh. Bye.
Boom. That was good.